So in this corona times, we had these problems of hypermature cataracts. So here there was one with zonular dehiscence and weak zonules, and we could just manage to round off the capsulotomy. And it was a wobbly nucleus, as you can see. These nucleuses are very difficult to chop in a bag which is compromised, because we didn't know whether there was rhexis extension there. So we went back to what we have been taught, a lovely Indian technique, the IOL scaffold. And we have the nucleus in the outside the back capsular complex. And we cut the nucleus with the Capina's IOL cutter and into 4 pieces. And so here actually the problem lies that you have a wobbly posterior capsule, you have a nucleus which rotates, and you have a rhexis which, because of the capsular fibrosis, tended to escape to the periphery, and we're not very sure whether it has extended beyond the equator. So having done this procedure, I think we have safely put the lens and taken out the nucleus. So we, as has been everybody's experience during this period, this is another cataract, similarly with a capsular fibrosis, as you can see, especially in the upper part. And again, the same thing happens. You cannot manage the posterior, the capsular rhexis, and you have to create a weak spot by cutting there. And you have a wobbly nucleus which is supposed to chop in the bag. So naturally, again, it was brought extracapsular, and it was divided with our favorite snare. So you just go beyond the equator, curve around the nucleus, get the whole nucleus in, and lasso it down into 2. And the same procedure was done.
I adjust the volume on my laptop. Then even
of course, we had simple solutions. I'm a person who believes also with simple things. So this is a simple way of doing these cataracts. You do the standard SICS with, and you are free of these apprehensions. I heard Chitra talking and telling me that this previous nucleus was very hard. Yes, it was. The total energy consumed was around 18 in the anterior chamber. Of course, I can tell Chitra that it was the nucleus, the first day, except a little striae, it was fine. So you do the envelope capsulotomy, and you bring out the nucleus. And here you left with the anterior capsular flap, which at the end of the procedure, you can generally hold even with a Simcoe cannula, and you can just remove the anterior capsule. So now you can put the lens in the bag. Thank you for your attention. Thank you very much.